I'm Griffin Jones. I am a second-year Doctor of Public Health student at the Chan School of Public Health, and I've been working with the FXB Center for the last year on their initiatives related to ending the US's racist drug war. I grew up in Portland, Maine, and have been in the Boston area for the last 10 years, working both in the healthcare sector and in health policy. Mainly for the state's health policy commission. I live with my wife and 3 kids in Arlington, Massachusetts. I came to public health through healthcare, through years of essentially trying to bend the cost curve on healthcare cost growth. Here in Massachusetts, I was part of an agency, essentially a consumer watchdog, trying to manage healthcare costs and keep them under control here in Massachusetts, where we have universal healthcare coverage. And I did that through a series of grant investments and designing grant programs for essentially to demedicalize healthcare and to try and get care to where we knew that it made the most impacts on people's health, which is not in healthcare service delivery. It's actually in communities and in all the places where we live, work, and eat and play. And eventually I realized I was just reverse engineering public health. And so that's why I came to the Harvard Chan School to really formalize what I knew about the determinants of health and what I could do about it in order to translate, to consume that science as a informed consumer and to translate that into practice on the back end. And when I got here, I looked around and tried to find those centers or those professors or just groups of people who were interested in the same work as I was, interested in work around structural determinants of health and power inequities that lead to worse outcomes and disparities. And everywhere I looked, I just kept seeing the same name, and it was the FXB Center for Health and Human Rights. And I kept seeing Mary Bassett and Natalia Linos in all of the meetings where I was and wanted to know more about how to get involved in the work. And so I eventually found my way to the center, looking for opportunities to help support and engage, especially around issues of these power imbalances and especially racial disparities within those. And so that's how I was able to find an opportunity to support the center's work. First on the opioid crisis, especially as it's been exacerbated by structural inequities, and then the opportunity that we currently have right now for policymakers and legislators to use the funds coming out of the opioid settlements that are still being litigated, and to use them in equitable and structurally informed ways, which at the moment they had no particular intention or design to, but the working with the FXB Center in order to develop meaningful collaborations with funders and stakeholders and policymakers in this space has been a really exciting opportunity to try and steer policy and to steer actual practical changes to the way that these problems are conceived of and to really advocate for sensible and evidence and policy, and evidence-informed approaches to reducing the disparities that are so evident and exacerbated now by the COVID-19 crisis. I'm interested in pursuing a career at the intersection of health and human rights because being of use and being helpful in reducing injustice in the world is an animating impulse for me. And I think especially as my journey through life and education and trying to educate myself and be self-aware, especially as someone who sits at the intersection of innumerable privileges of being a white American cisgendered heterosexual male, is really a journey of being aware of all of the privileges that I've been given and that I've enjoyed and all the luxuries that I'm afforded that others aren't. And so it feels like there is no greater use of my time than to make sure that others that everyone is able to be afforded the same luxuries as I am. I'm motivated to do this work because I love hard problems and I love challenges. And there are perhaps no richer challenges than the ones that are truly at the intersection of health and human rights, which I was, I grew up being taught that health and human rights were that healthcare was finished science, and we knew most of what we needed to know, and that innovation in those fields had everything to do with just trying to solve narrow problems of old rich white men. And so having the chance now to expose and look deeper at the science and the moralism that the structural determinants of where and how we conceive of who gets health and who deserves health and who would we even allow to deliver health. And those questions are really interesting because they're so messy to me. And so those are the kinds of challenges that I'm excited to tackle now with my training at the Harvard Chan School. And then the practical experience and mentorship from Mary and Natalia that I've gotten at the FXB Center. In the future, I hope to be a change agent in the ways that I see Mary and other members of the FXB Doctoral Cohort getting into spaces and using judicious and informed approaches and translating real knowledge into meaningful and actionable observations about what are the judgments that our society makes about who is valued and what is valued, and then really putting what we know out there in ways that are impactful to the people making decisions and to the public at large on how to approach problems that I think are to problems that we think that we understand really well, and that all we need to do is find a solution to it. And I think a lot of the problems that I'm interested in and the ones that I see the FXB Center tackling is problems that we really don't know at all, or at least if we do know them, we've decided that we don't want to solve them in a certain way. And I think the drug war or reparations, or the treatment of marginalized communities in Europe, like the Roma, are all examples of those kinds of challenges that too many are afraid to tackle or to raise their hand and say, we really don't understand this well enough, or we're approaching this from the wrong direction. And I think all I've seen from the FXB Center is a courageousness to do just that and to make sure that we don't move on while leaving other folks behind. The COVID-19 pandemic affected my education. Obviously, going remote and trying to attend classes was really hard, especially as a parent of 3 young children, one of whom has been in Zoom kindergarten for the last year. It's obviously been humbling and I think has made me forced to think really judiciously about where I spend my time. But one of the other kind of motivating, one of the other animating influences for me has been, how can I help respond to the crisis? And especially as a busy father and student, it's been really hard to find ways that I can actually plug in and help. And but throughout working with the FXB Center on responding to people who haven't been the center of the attention during COVID-19 has been a really fulfilling opportunity to feel like like I am contributing to helping people during this crisis, people who I wouldn't have been able to help otherwise without a real vehicle to think and to write and advocate for people who don't have those voices. And moreover, it's just been inspiring to be so close to the work of the center, who I saw ratcheted up in word and deed throughout, anywhere from there wasn't a week that went by where someone from the center wasn't publishing, several different things, and trying to give voice to the voiceless during the pandemic, to the civic participation and in Natalia's run at a House of Representatives seat was truly inspiring, especially as a fellow parent, to see that level of commitment and depth of empathy that my colleagues at the FXB Center showed was really inspiring and motivating for me during this crisis.